All right. Welcome. Thank you for joining us this Wednesday evening as we're going to go through probably about 45 minutes to an hour here talking about the shoulder. And the goal of this talk is to give everybody who's on and whoever watches this later on our YouTube channel some practical tests that they can utilize to identify limitations in mobility in their own shoulders, identifying limitations in neuromuscular control and strength, as well as some really practical applications of posture and sleep positioning and things like that to minimize stress on the shoulder so that you can maximize your potential. My name is Pete Rumford. I am one of the physical therapists here at IPA Physio OC in Orange County, California. And I understand we have some people from all over, not just people that have seen us here in the clinic, but maybe some of you on the East Coast as well, staying up late. So thank you for being with us. If you have any questions, I'll be periodically checking the chat box. I'll definitely save some time at the end to go through and answer any questions that you have. We'll paint an overview and then also have a few times where I'll stop sharing my screen, get on the floor, do some exercises. And I'll ask that you'll get the most out of this if you participate and you go through the mobility exercises, or the mobility tests and some of the exercises so that you can feel these things on yourselves. And then again, apart from that, I hope to just provide some ideas that can get you thinking. If you're someone that wants to improve and maximize your potential with regards to your shoulder, or if you're someone who's dealing with pain and wanting to eliminate and get over that pain, we're going to hit and tackle a lot of those strategies. So the first thing to address, and one thing that I typically say, is you can't get better if you keep getting worse. And there's a lot of ways that we can mitigate onset of pain and we can mitigate injury by an ounce of prevention being more than a pound of cure. I'll use a lot of metaphors tonight, I guess. So if you look at this list, some of the primary injury risk factors for the shoulder include a history of shoulder pain. That may sound obvious, and really it is, but it surprised me as I was going through some research that volleyball players that have a history of a shoulder injury are 9 times more likely to injure their shoulder than somebody who does not have a history. So that's a very significant increase in risk of injury. And I work with a number of volleyball players, and one thing that I consistently see is the tests that I take you through tonight, they don't pass those tests. I see a lot of really weak shoulders, weak rotator cuffs, weak scapula stabilizers, weak cores. And unfortunately, particularly with our youth and kids that are going through these programs, be it volleyball, be it baseball, whatever it is, this trend towards early specialization puts a large overload on these kids. And that's great if their bodies can handle it. And if they're not prepared through optimal mobility and strength, it can really be problematic. So that recurrent cycle of injury, get mostly better, injure again, we want to help break that. So other risk factors include poor mobility, weakness. In general, it's weakness of the anywhere from the neck to the core to the shoulder and the scapula stabilizers. But it could also mean weakness in the lower extremities for a pitcher that's got to push off to throw the ball at high velocity. So we got to look at the whole system, but primarily what we're going to be focusing on here in this hour is the upper quadrant and that shoulder and scapula. Talked about those other points, so let's move on. I won't take too much time here, but for those of you that are not familiar with the anatomy of the shoulder, a couple of key things that I'll refer back to that I want you to be paying attention to. The shoulder is the primary shoulder joint is a ball and socket joint. That's the glenohumeral joint that you see here on this screen. The roof of the joint is the acromion, which is part of your shoulder blade. And then your collarbone and your clavicle comes in to join that acromion. How do I show that? Good, right about there. These two come together and form the AC joint. Some of you have heard of the AC joint. A lot of athletes can sprain this joint. Particularly notable are NFL quarterbacks when they get sacked and they land on that shoulder with a 300-pound lineman on top of them. They're likely to either sprain that joint or fracture their clavicle. Don't always know why one happens more than the other. Probably the angle and the load is determinant of that. But if you see people walking around with a big bump on their shoulder that goes up and then down, that's likely that they have a history of spraining that joint to a degree that they tore the ligaments that hold it together. Now, even if they've never injured that joint or you've never injured that joint, it is the roof of the ball and socket joint. So we'll talk about friction of the muscles that go under it here on the next slide. But just understand that the primary shoulder joint, ball and socket, and then you have your shoulder girdle is what we call it, which is consisting of your collarbone and your scapula. Those form the roof and the socket. The rotator cuff is 4 primary muscles, and then we could throw the biceps tendon in there as one of the primary stabilizers as well. You see how these muscles come from both the back of the shoulder blade. Do you mind grabbing the shoulder model for me? Thank you. I've got a lovely assistant here. They come from the front of the shoulder blade, and if you can envision a person standing facing us, this would be their right arm. And one of those muscles attaches to the front side and goes out and attaches to the ball. That's called your subscapularis. That muscle does these motions. It internally rotates. All right. On the back side, what you don't see here is the muscles that come from behind and run up and attach to the back and over the top of the shoulder. You can see the supraspinatus tendon over the top of the shoulder going right under the roof of the joint. These muscles help to stabilize the ball in the socket. The next slide, we'll talk about muscles that stabilize the shoulder blade on the rib cage. But if these muscles are working effectively, that subscapularis, which is pictured here, helps internally rotate. The muscles on the back side help to externally rotate. And the muscle over the top helps to initiate a lifting motion of that arm out to the side. But when they're all working together well, they create what we call centration, or keeping that ball in the socket, not letting it translate too far forward, too far back, too far up. Because you can see how these tendons, they run by these bony prominences. If there's not optimal mobility and control of the ball in the socket, it will impinge or friction and eventually kind of wear down those tendons and some of the ligaments around the capsule. So rotator cuff, responsible for stabilizing the ball in the socket. Muscles such as the trapezius, the serratus anterior, and the rhomboids, to name a couple, help to stabilize the scapula against the rib cage. So that shoulder blade sits flush to the rib cage, and it's not attached to the rib cage by anything other than muscles and stability. So it's like a floating joint. The only attachment of the shoulder to the axial skeleton is actually at the breastbone here. So there's a considerable amount of mobility here. And in order to have the mobility that we have, we've sacrificed some stability. But the stability that we gain and that we need comes from muscles stabilizing the shoulder blade, these muscles, and muscles stabilizing the ball in the socket, the rotator cuff. Those are the muscles that we need to consider as we look at any kind of strengthening program. And those are the muscles that become oftentimes problematic through some of those friction mechanisms that I outlined. Thank you, Ryan, for managing the chat. All right, so I'm going to go right into a couple of self-tests. And what we'll do is look at these on the slides. We won't take too much time. And then I'm going to share my screen and I'll do them. And I want you to do them, even if you have to modify them so that they're not perfect. That's fine. I want you to be able to identify on yourself where you're limited, either on both sides or where you're limited on one side. One of our mentors said, if you're tight and symmetrical, be aware. If you're tight and asymmetrical, beware. That's where you're going to start to get into problems. When one side is doing too much and the other can't keep up, or one's doing too little and the other's trying to compensate for it. So one of the first tests is the shoulder flexion test. We're looking at how well one can elevate their arms straight out in front. My back is against the wall because I don't want to see how well someone can lift their shoulder by arching their back and shifting their hips forward. That's a common compensation. I'll get people here in the clinic all the time. You see with my range of motion there, ideally I'd get my thumb to the wall and my arm would be at about 180 degrees. I get people in here all the time with shoulder pain who get to about 130 degrees. So picture somewhere between where I am and straight out in front of that person. That's as far as they can lift their shoulder without compensating. That shoulder should be able to go another 50 degrees or so into that range of motion, but it's gotten stuck there. The good saying is the body is cement waiting to harden. And if you don't move through a particular mobility often, you're going to lose it. So once you lose it, you compensate. Once you compensate, you use muscles inefficiently and you create problems, you create pain, and the cycle perpetuates itself. So we'll look at this on each other, both sides, or we'll look at this on yourself. You can do a quick test here in a minute. This will be the first thing that we look at. The second thing is looking at combined hand behind head and hand behind back. So we're looking at what is considered external rotation biased motion versus internal rotation bias, because you're having to internally rotate to bring the arm behind and externally rotate to bring it overhead. Ideally, you should be able to interlock at least your fingertips. You should at least get to, if you have fists like this, to where it's not greater than one fist distance between your hands. That's a common metric used and a common determination of mobility. What you'll notice on this one is most people lack internal rotation in their dominant arm, primarily if they grew up playing sports, throwing sports, overhead sports. There are bony adaptations that occur because of the throwing and hitting motion, and I'm happy to get into those at the end. If you want and you're interested, make a note and then put that in the chat box at the end. But this is a quick scan of internal rotation and external rotation combined ranges of motion. The ability to extend the arm behind oneself, to reach behind and grab something out of a chair, to power oneself as you go up for a jump in volleyball or basketball, that requires shoulder extension. You should have about 60 to 70 degrees of this motion, and very common for people to hardly be able to lift their hands off of their back, particularly when they have pain in the front of the shoulder. That is because of shoulder mechanics getting to a point where any kind of extension motion puts too much stress over the front of the shoulder. So if I'll make note when we're going through these about certain pain conditions, and if you're feeling pain, I want you to know your body and don't force into pain. Horizontal or shoulder adduction, just that ability to get the arm across the body here. Our goal is at least 50 degrees. Think about very functional. If you need to wash yourself on the opposite side of the body, common complaint that we hear in normal activities. If you're doing martial arts or you're doing various sports, you have to be able to get that arm across your body. And if that's limited, it's usually to do with the tightness in the back of the shoulder and tightness in that AC joint. So what you'll look for is side-to-side differences, and make note of that. The difference between this one and the first one is in the shoulder flexion test, we came right up in front. With the abduction test, we're coming out to the side. And I want the palm starting against your body and staying down so it's relatively facing outward at the top of that range of motion. You should be able to hit yourself in the head. And if you can't, it's limited. And why it's limited, we'll get into some of those mobility factors and things that you can do about it. So I'm going to stop sharing for a moment here, and I'll go through some of these tests briefly. In the chat box, I put a link. And Hannah also should have sent this out to all of you guys. It's a checklist. Mine's a little marked up, but it looks like this. If you want to keep track on yourself, you can just make quick notes. So again, if you have the ability, I'm going to go through this rather quickly, and I want you to follow along and do it yourself. So I'm going to go against a wall here. I'll be against the door. I will flatten my back so that there's no arching. And with my back flat, I'm going to take my left arm, elbows straight, come up as high as I can and see if I can touch my thumb to the wall. If I can't quite get there, I want you to eyeball kind of where you are. Are you at 90 degrees? Are you somewhere between 90 and 180? Or are you able to get your thumb to the wall? Head doesn't have to be far back against the wall, but I don't want it jutting forward. Common compensation I see is people keep that elbow slack and they just lazily kind of bring the arm out to the side. That's not what we're looking for here. We're looking for straight in front, elbow straight. How high can you get? How high can you get with your opposite arm? Eyeball it. Make a note if there's any significant difference. Okay, so that's shoulder flexion. Hand behind head, hand behind back. You can do this standing or sitting, but what I want you to try to avoid either way is a lot of arching of your back. Take your right hand behind your head, left behind your back. Are you able to interlock? If not, how far apart does it feel? Okay, opposite, you can see I'm a little more limited with my right going behind and my left over the top. I am a right hand dominant, played baseball, played volleyball, kind of fits the typical pattern. That doesn't mean it's efficient. We want to get things as symmetrical and springy as possible. The prone extension test you can also do in standing. And if you don't have a stick, which I showed in the picture, you can just interlock your hands, try not to arch your back, and bring your arms out to the side. If you could do this in front of a mirror, I have a mirror next to me here. I can look at my arms and see, am I getting about halfway between shoulder height and starting down at my back? Just to get your hands interlocked takes some extension. And if you have a shoulder problem, such as a frozen shoulder or even front of shoulder pain, that may be hard in and of itself. So you could just pause there and say, this is challenging. If you can't do this, there's no way you could have done this. So I should probably reorder that in my sequence of what I'm having you go through. All right, so what was your range of motion on that one? Reach the arm across and pull it towards your body. We call this 0, 90 degrees would be totally straight across. Can you get to at least 50 to 60 without pain? Opposite arm, can you get to at least 50 to 60 without pain? And then the last one, palm starts against your side. Orientation stays the same. So at 90 degrees, palms down. Can you hit yourself in the head? Opposite side, can you hit yourself in the head? If you can't, note at any point where the pain is and or where the end of your motion is. So that's quick test. If you went through that, hopefully you identified a few areas where you have some limitations. And now let's talk about what we can do about that. I'm going to go back to sharing my screen. So one of the first things is utilizing tools such as this, or a bigger ball, or I like this Theracane for getting top of the shoulder. The thing when you're doing this at home on your own and you don't have the feedback of a PT or a doc or someone to help you diagnose, like, yeah, you likely have a supraspinatus strain, or you have impingement syndrome is something we might call it. You might have a frozen shoulder. You might have an AC joint issue. It's helpful to get that feedback, right? But if you go through these ranges of motion, and these mobility tests, avoid sharp pain. If you're starting to work through these mobility exercises on your own, I don't want pain to exceed 2 to 3 out of 10 tops without you really having a full understanding of what's going on. But you can start to utilize some of these mobilization tools and these exercises that I'm going to show you to chip away at your range of motion. And a little bit a day goes a long way. It's better to spend about 5 to 10 minutes a day doing mobility exercises than 1 to 2 hours one day a week. Research shows that. Common sense shows that. You got to move these big joints like your shoulder and your hip through all of their range of motion every day to maintain that stability. So the primary areas that I would have people mobilize around the shoulder include the outside border of the shoulder blade. And you can see me doing that on the top picture on the left of the screen, where I'm lying on my side and that ball is contacting me along the outside of that shoulder blade. So if you see on this model here, I'm getting into this area between the shoulder and the arm, because when that arm comes out to the side, these muscles have to lengthen. So we're getting compression to those muscles. Compression alters blood flow. It alters pain activity and pain reception, and it increases the elasticity of the tissue. When you're self-mobilizing using these compressive type procedures, I recommend that letting the pain subside by at least 50, ideally about 75%. So you find a trigger point, you stay on that point, don't just roll on and off of it, but identify like a sore spot. You can then shift your body slightly, move your arms slightly, but keep the pressure on that point till the pain subsides by about 50 to 75%. That'd be a good indication that something is happening in the tissues in which the pain is decreasing, the water content's changing, the blood flow is affected, you're going to then be able to stretch and mobilize that tissue better later. If you just roll on, roll off, you'll get some effect, but it won't be as good. So another area that I like to mobilize is that top rotator cuff muscle, which is the supraspinatus. And that's where this comes in handy. And I can use a theracane and get that ball right into the muscle belly, which runs on the top of the shoulder in this little groove on the top of the shoulder blade, if you remember where that supraspinatus was. So again, I could lock on there, apply some pressure, tilt my head to the side, look away, provide a little bit of a strumming back and forth motion, and stay on a spot that feels tender until the pain reduces by, again, about 50 to 75%. Your pec muscle, your pec minor, is a muscle that runs from just inside the front of the shoulder down towards the nipple. And if you can get a ball on there and go up against a door frame, that muscle is often very stiff and tight and tends to keep that shoulder blade tipped forward. Think about all the activities that we do in front of us. The most important position of your shoulder blade is verticality without tipping forward. This muscle, because it attaches to the front of the shoulder blade to the rib cage, can get kind of bound down and stuck. Muckety muck, as one of our therapists likes to say, and it'll just get stuck there and pull that shoulder blade forward. So we need to get some extensibility there to be able to open up, and we'll go through that in some of our exercises. And the last place for now is the muscles on the underside of the back of the shoulder blade. Those are your external rotators. And if you try this and you put a ball against the outside of your shoulder and you kind of lean into it on the wall, I really recommend you do this on the wall first, because if you do it on the ground, there's some serious trigger points in here. You may hit a point that feels like pain is shooting down your arm. Like, as long as you're doing this against a wall, your head and neck's not in a crazy position, that's not because of anything related to the nerves in the neck. It's related to tightness and tension in these external rotators of the rotator cuff, which are often overworked and underappreciated. Those are the muscles that when a pitcher throws have to decelerate the arm as it comes across the body repeatedly. But how often are we strengthening and countering that motion? Usually not enough. And it doesn't have to be a pitcher. It can just be all of us sitting at our computers with our arms forward, stretching these muscles out, letting them get all lazy and not working on strengthening them and increasing blood flow to those muscles. So this is where I start. And you can do these on your own before then going through mobility, stretching, that kind of thing, because it's going to enhance the ability to stretch afterwards. So some of the basic starting type exercises that I would have people do with regards to their shoulders is combining shoulder flexion, which is that straight arm position, with exercises that will also enhance mobility of the mid back. Our mid back tends to get rounded, right? Because of what we do, or we get stuck in this position. And if you want to try something real quick, go ahead and just slouch and lift your arms as high as you can. Okay. Now sit up to neutral and lift your arms as high as you can. Now keep your arms up there and slouch, and feel as you slouch how much more pressure goes into the front of that shoulder. Your spine position has a significant impact on your shoulder function. So if we can do exercises that both enhance flexion, which is typically the least aggravatable position, if I just made that word up. A lot of times if people have shoulder pain, coming out to the side might hurt, rotating behind might hurt, even going back like this might hurt, but people can usually get away with straight in front. So we can start to open up that mobility as well as let that chest drop down. We'll go through a couple of these in a little bit. Other great stretches include hanging. I don't know how many of you hang on a regular basis. If you have a pull-up bar at home, something that you can just latch onto and let those arms open up. And I have a picture coming up later of my daughter doing monkey bars. And we all used to do this kind of stuff, and it was so good for the health of our shoulders. But over time, we've lost that upper body strength and we've lost that extensibility. And we need to get that back as much as we can. We need to be functional. You should be able to run, swim, climb, jump to save your life. I'm a believer of that. And the ability to hang and pull with your upper extremities is critical for that. Another one is a sideline shoulder circle, which is one of my favorite motions because it's a combined motion of the rib cage, the mid back, and the shoulder that utilizes almost every range of motion that we're attempting to gain. So I'm going to just demonstrate that sideline shoulder circle here. And if you have space, you do need a little bit of space. I want you to try this and feel it on yourself. I'm gonna come over to the ground and I'll lie on my side with both knees up to about 90 degrees and my head well supported. My bottom hand will hold my knees down. That helps for reproducibility for one, but it also makes sure that I'm not just bailing out my hips to get more mobility. The first thing I want to do is reach forward and then open up. Ideally, I should be able to get my hand to the ground on the other side. From there, I want to watch my hand the whole time. So I've turned my head, I've turned my chest, and I want to watch my hand up and around my body and trace as big of a circle as I can. If I have paint on my fingertips, I'm trying to paint the biggest circle that I can as I roll around. And you can go both directions, but you're moving from the shoulder, the head, neck, mid back, low back, hip to create this motion. If that's easy and you can keep your hand on the ground the whole way, you straighten the bottom leg, you take your lower body into a little bit more rotation, and you repeat the process. Make sure that you can see your hand the whole way around. All right, so obviously lots you can do, and I'm not building a specific exercise program for every demand by sharing some of these examples, but that's one of my favorite exercises, hanging if you can take it, and then make sure that we're mobilizing the spine and the mid back and the muscle bellies of those muscles that are in question. If you're doing that, you're off to a great start as far as enhancing the mechanical capacity of your shoulder. Now let's talk about neuromuscular control and then do a few tests here. What do we mean by neuromuscular control? It's essentially how well do you control the movement that you have available to you? How well do you control that mechanical capacity? You may move well in every direction that we just tested, but your strength, your coordination, and your endurance is not good. That would say that your mechanical capacity is fine, but your neuromuscular control is not. Strength and endurance, power and springiness. These are aspects of neuromuscular control. When we're talking about the shoulder, again, I already referred to this, but I'll come back to it. We're talking about shoulder blade, scapula stability, the ability of the muscles like the trapezius, serratus anterior, and rhomboids to stabilize that shoulder blade, which is the socket, and then the rotator cuff to stabilize the ball in the socket. So we won't practice all these tonight, but I want you to see, and again, this is not all inclusive, but you need to have a strong neck core. That'll be next. You need to have a strong core. You should have the ability to stabilize yourself through the shoulder in different positions. The reason I like this test, which is called the Bunky Test, is it challenges fascial lines. You can see the top picture where I'm on my side lifting one leg. That's challenging the outside line of the whole right side of my body, from my shoulder to my lat and my obliques to my quadratus lumborum, my lateral glute, down that IT band into my foot. I need to have stability down that whole chain in order to stay in that position. The goal is 40 seconds. The one next to it, it's the inside part of my leg, your adductors, your groin muscles, your medial calf. Those need to be strong in order to transfer weight from your upper body to your lower body. And then you see the front and the back versions. The reason I use this test, and you could try it on yourself in these different positions when you have time, is we're looking for symmetries and asymmetries. And I'll have some people that can hold like one of these side blank positions for, I had a runner who could hold about 30 seconds with his top leg lifted on one side, and he couldn't even lift the top leg when he was on the other side because he had such significant weakness in his right hip. So it helps to identify those red flags or cautionary flags that are thrown up to say, this is so asymmetrical, and this may coincide with why, in this case, why the knee hurts or the foot hurts or the back hurts. So we need to address that. And you can address it in this position in a regressed way, or you can do other exercises once you figure out where you're weak and then build it back into this position. So this is one thing. You got to have a strong core. Let's say you're going to rappel down a mountain and you got a really strong rope. Doesn't matter how strong that rope is if whatever you attach it to is not strong enough to hold your weight. You want to make sure that that anchor is as strong as possible. So that core needs to be strong and your neck needs to be strong. So this is a simple test. We're not going to go through the whole test. Well, maybe we will. We can in a few minutes here, but you should be able to hold a position where you've lifted your head and you've tucked your chin, and you can just stabilize and hold that position using the front neck core without lifting your head further or elevating your chin. So it's the ability of the muscles that draw the chin down and keep the neck stable to demonstrate appropriate strength and endurance. Many people have a hard time with this. I hesitate to even do it because most of you will probably not do it in a way that would actually pass. We look very closely when we're having people do this here at our practice and seeing, okay, if that chin starts to lift or that head starts to go forward, we want to stop the test. If they start getting a lot of tension in the back of their neck and it's reproducing the headache, we stop the test. That means they're not activating the muscles correctly. So I'll go through, I'll kind of set up the position. We won't necessarily try a minute hold. You can try it on your own at some other time if you'd like to. But the neck stability and neck strength is critical. This is called the push-up stability test. This is part of the functional movement screen, which is a fairly well-known tool in the strength and conditioning personal training world. The point of this test is many people do push-ups, and it's one of those things where, oh, you haven't worked out in 2 years and you get back to the gym, let's do some push-ups. But if you can't do this test, and I'll show it to you so that you see exactly what we're looking at, you should be able to push up from the ground to top of push-up position with no delay or lag in the spine and pelvis. And I see a lot of people that can't do this. So if you can't do this, that means that your core control between the arms and the legs is not sufficient, and you shouldn't be doing push-ups. You should be doing core work and working that stability to then be able to do a push-up. I shouldn't say you shouldn't do push-ups. You shouldn't do push-ups from the floor. You could do an elevated push-up. You could modify and put something like, I'll put a 4 to 6 inch step under someone's hips and stomach, so they just like go from there up in the range that they control well. But otherwise you're at high risk or higher risk of injuring your low back, injuring your shoulders, that sort of thing. And I talked about hanging. Everybody should be able to hang for at least a minute. That is the baseline that I utilize as far as a test. You don't need to do it the way I'm showing here. This is a little bit higher demand on your core, keeping the knees up, but being able to unload and dead hang for a minute is something that I want everybody to be able to do. That would imply that you have good elasticity and tensional integrity of the fascia from your hand all the way down. Think about what this takes. It takes significant grip strength. Grip strength is related to duration of life. As you get to be older, the stronger your grip is, the higher likelihood you have of living longer. That's a very significant fact. And things like pull-ups and hanging can really enhance that strength. So think about that as a neuromuscular factor as well. And then I put this in here because this is one of those for overhead athletes that I like to look at. Can they, in a child's pose type position, lift one arm while their spine is biased towards flexion? So it's kind of like when I asked you when I was slouching to lift one arm and how that affects your shoulder range of motion. Well, even if you're flexed and if you're an overhead athlete and your arm's up there all the time, I still want you to be able to access and get that shoulder lifted. It just puts you at a disadvantage, and I want to see if you can do that, and if you can do it on both sides, and with what kind of strength and endurance you can do that. All right. So I'm going to go back to the mat here. And again, feel free to try a few of these things on your own. Otherwise, you can just watch as I demonstrate what these tests are. And I'm not going to do all of them. I'm not going to go through the bunky, but I want to show the head and neck, the neck flexor endurance test. So I'll put one hand under the head and I'll lift my head to a point that it's usually about 1 inch or 2 off the table, and it feels like it's in line with my body as opposed to relatively behind an extension, because I don't want to be at such a disadvantage. So I'll tuck my chin and lift my head. I keep one hand under the chin, and as soon as I've tucked, I don't want to move this hand because it's a cue for me. I need to keep my chin against that thumb, and I slide my other hand out. Now I can monitor with like a finger without holding my head to see if I elevate, if I drop, or if I lift my chin. Any of those things would indicate failure of that test. But the ability to tuck, lift, and hold for a minute is passing that test. I don't want you way up here. So again, it's about 1 or 2 inches off, head unloaded, so you don't feel like it's falling behind you, chin tucked, stabilize and monitor. Tongue on the roof of the mouth helps a lot because that stabilizes the tongue and those muscles attached to the front of the neck. So again, you can try that on your own time. Now the push-up stability test, sometimes they'll put the hands further up here. I'll just put the hands outside of the shoulder. Notice, yes, my back in this position starts a little bit sagged, okay, because it's lower than my ribs as I put my shoulders down. But I don't want there to be any more sag. So if I do it wrong, and this is what I see a lot of times when I ask people to do this, there's this like lag at the pelvis. What it should look like is as you go to push up, as soon as you go to push up, everything pushes up as a solid unit. Again, wrong would look like this, or feel like that. Right would look like this. Pushing straight up, maintaining that stability through the midsection. And then the last thing that I want to demonstrate that you can try on your own is the child's pose position arm length. So you come down into child's pose. I'd like the forehead to be resting on the ground. And what I'll have the person do is push one hand down to stabilize and lift the other hand. Then push the other hand down and lift. Okay? So can you do that on both sides? And if you can, how long can you hold? And I'll usually do about a 30-second hold just to see if there's that endurance of the ability to lift that arm. Again, the shoulders or the rib cage has been put at a disadvantage. It prevents people from compensating and arching to get the arm overhead, and gives me an idea if this person is able to be loaded with overhead activities. All right, we'll talk about some of those things as far as like an overhead farmer's carry and things like that. But I'm not going to add load to a system that doesn't have appropriate mechanical capacity and neuromuscular control. So you can, again, try, maybe you tried some of those right now, or you can try those a little bit on your own. Let's talk about some of the basic exercises that I'll typically utilize. I mentioned this earlier. I'm big on the functional components of strength. Integrating the arms with rolling. I'll demonstrate that. Crawling, these plank positions. A lot of people say planks aren't functional. They may not be functional, but they build tolerance of tissue load and tension in the front of the body, the back of the body, the side of the body, the inside of the body. Depends on the position you're in. And that ability to load statically can then be extrapolated to all sorts of positions. So hanging and pull-ups, again, those are very functional, and everybody should have the capacity to move in as varied of a way as possible. This is a series that I'll give almost everybody if I'm working on the upper body or the whole body or the head and neck. The stability of the shoulder blades and the rotator cuff is addressed with this. I'll go through a brief demonstration, and hopefully you'll go through a few exercises with me after we talk through this section. But the second position, this W position, is what we call a pivot prone position. And as a child is developing, they lie on their stomach during tummy time, and they start lifting. They extend their back, and they draw those shoulder blades back. And what they're doing is they're starting to activate those muscles between the shoulder blades, those rhomboids, the trapezius. Once they have the capacity to activate those muscles, what do they start doing? They start pushing down and lifting themselves up. At the same time, they're on their back. They're working on like knees up and playing with things on their back. And eventually there's a connection and they roll. So now they've got core control, they've got scapula control, and they've got the ability to press up. Now they start crawling. And so the concept is that there's a developmental sequence in which we develop strength through the shoulder. And our exercises to a degree should mimic that. And then it should also mimic specific specific areas that lack strength and sport specific tasks or activity specific tasks. So the reason I like this series so much is it hones in through various positions of the arms, the muscles between the shoulder blades, and you can really work on strength and endurance there. And then you can start to load, but you've got to move slow before you can move fast. And I don't want you doing these exercises with a lot of like momentum. You should be able to stop anywhere in the range. A lot of times I'll show someone this exercise and they'll be like, all right, great. And they'll go grab 5 pounds or something. In 5 pounds, you're not going to do it right. I don't care who you are. You're going to start shrugging up if this is the first time, and you're going to start using substitutional patterns. So it's important to start and master your own body weight again and get the proper technique before you add load. So this is a very important position and critical muscles for you to start training. Another concept to share is that transition to overhead. So if I go back to this slide, you'll see that the last two, the arms are starting to come up to overhead or get to overhead. There's tons of other exercises you could do that are going to get the arms prepared to start reaching overhead. I really like this one. And in this exercise, I'm kneeling with my left hand on the wall, and that left hand's kind of pulling down to drop my ribs and activate my front core. Then I'm taking the kettlebell and I'm holding it, and I'm slowly rotating out and I'm rotating in. So I'm like kind of a door on the hinge. And I want to be able to stabilize that motion without compensating. Having the kettlebell with the heavy part facing up produces a more unstable situation because the weight's up top. So it's top heavy. So I can move in and out. And so I want to move through this range knowing that I've got good gradual control before I then start to press up overhead. And I can press up at any point in that range of motion. But I'm developing that stability and that base first, from which I can then reach up and overhead. Again, just one idea here. Other concepts of overhead training I have on the far left of the screen, I believe it would be. I'm doing an overhead farmer carry. A regular farmer carry would be just holding the kettlebell down at your side. Also good for training lateral core stability because you've got to compensate, or you've got to use your left core if you're holding it in the right hand as you move to prevent that side bend of the trunk. But you can also do that with the arm overhead, and you're developing strength and endurance and control and coordination with that kettlebell overhead. I'll do hanging where I'm marching like one leg up, one leg down, or any variation of leg movements to train my core while I'm hanging. I played volleyball, and when you're in the air, generating power to spike the ball, the legs are important for getting you there, and they initiate that jump. But once you're in the air, where there's no stability from the legs to swing. So when you're hanging, you can start to engage your core, generate strength while you're creating that tensional load through the arms, and work on that activation of legs going up and down, legs rotating, coiling to mimic some of those motions. And it's true to a degree of all sports, but like with pitching, you can really drive from that foot to generate a significant amount of the velocity. Now, the higher you jump, the more advantage you have, yes, but then your legs are no longer on the ground to help you achieve that translation of force. The last picture is a mace, and this is fun because it just looks cool, but it's top heavy. This one's like 20 or 30 kilograms, and you hold it and you swing it around and come to a stable stop. So you're translating force. It's a great range of motion exercise to reinforce range of motion, and it's a great stability exercise, and you can choke it down or choke up to make it harder or easier, but it's also helpful in training that overhead function. So I've enjoyed playing around with this thing a little bit. And then plyometrics, you got to get to where it's springy. So one thing I didn't mention, and just because there's a lot, if there's specific weakness to external rotation in part of the range of motion or internal rotation, using bands or using exercises or things like that to strengthen specific rotational infraspinatus, teres minor, subscap, very important. Sometimes like PTs get a bad rap because they'll just give you a band and say like, do this kind of thing. Yeah, it's a lot more than that, but there are times where that's needed to get that specific activation. And then when I say specific rotator cuff on here, I'm talking about maybe someone's on their stomach and they're using like a weighted ball, doing some 2 to 4 pounds, where they're going up and down in a faster fashion that's creating elasticity. This ball obviously is not 2 to 4 pounds, but like a soft one. Or you could do some like external rotation releases with a 2 to 4 pound ball. So instead of throwing forward, you're working on throwing back and working opposite the range of motion that you would typically do. It'd be like a golfer that's always rotating one way, saying, okay, we got to do some chops and some exercises to counter that and go the other way. So that's what I mean by specific rotator cuff plyometrics. And if you don't know what plyometrics are, it takes advantage of what they call the stretch shortening cycle of the muscle. And it's a quicker, elastic, springy, more ballistic type movement. It's not slow, it's powerful. Jumping is a plyometric, jump rope is a plyometric, clap push-ups would be plyometric. Ballistic pull-ups, you could do things like that. And this is my daughter doing the monkey bars last weekend, and she's starting to connect them, and it's so fun and cute to watch. She gets so frustrated if she can't do it, but the ability to functionally transmit that load one arm to the next. If you haven't done monkey bars, don't just go out and do it. Start hanging, building up some of that stability. You got to regress and then progress, but it's a very functional, fun activity. Someone asked if there's a recording of this, and the answer is yes, it'll be on our YouTube channel. Just checking the chat real quick. All right, I'll come back at the end to some exercises for those of you that want to stick around. I want to keep going through this. So mechanical capacity is the mobility, essentially. Neuromuscular control is the strength and endurance of the muscles. Motor control, how well do you put it all together? It's the coordinated use of mobility and strength and endurance of mechanical and neuromuscular control. Posture and body mechanics, sport-specific tasks. When we talk about the shoulder, we're talking about how we sit. Are we always here? And is our neck always up and forward? And our arms always up and forward? Are our shoulders getting compressed the whole day? Or are we more vertical, head and neck's in a good position? We'll go through some of this opening up, but those shoulders can be more vertical. Remember I said about that shoulder blade, if it tips forward, that's the worst position you can have. It has to be, that shoulder blade needs to be vertical. Sleep positioning, like how you sleep is huge for shoulder pain. And I really recommend if you have pain and it hurts when you lie on your side, you got to try not to lie on your side. If you keep lying on your side and it hurts when you lie on your side, why would it get better? Think about the concept of pseudosurgery. There's a guy named Stuart McGill who talks about that for low back pain. If you had, let's go to the far end of the spectrum, you had to have surgery on that shoulder and you were in a sling for 6 to 8 weeks. Well, you'd have to sleep however that sling would let you sleep, and it wouldn't be on that side. So give yourself that break at night, and we can show you some tips for taking pressure off, but try to sleep on your other side, try to sleep on your back. And then looking at sport-specific tasks. And the main thing that I'm not going to get into with regards to motor control and neuromuscular control with sport-specific tasks is you got to be strong in the legs too. And I mentioned this earlier, we're talking mostly upper body, shoulder, scapula. But if you're a pitcher, if you're doing overhead throwing, overhead activities, you've got to be strong. If you're in the pool and you're playing water polo and you're playing volleyball and you're doing things where you're in a water medium or the air, I encourage, again, a lot of that like hanging core stuff and hanging stability stuff for the shoulders. But the legs have to be strong. And obviously with water polo, your legs got to be extremely strong too to get up out of the water. So it starts with alignment. And this is just a picture of some blocks to see that you are going to have maximal stability and control when your rib cage is stacked over your pelvis compared to if your rib cage is leaning back or leaning forward. I'm not going to get into this too much detail, but the primary compensations or one of the major dysfunctions we see with mostly with sitting, also with standing, is people stand in this like slouched position. And then when they function, their arm would only get to here unless they compensated from here. So essentially way too much motion is occurring in the low back. That's why people can hurt their low back doing shoulder exercises. And it's not unusual at all because their blocks aren't stacked. So it starts with optimal alignment and optimal posture. And again, for those of you that stick around, we can go into that in a little bit more detail. Actually, let's go through that right now. Why not? So take a break, stand up for me. And this is just a little cheat sheet, and I'll walk you through it, but I want you to feel it on yourself. Stand with your feet about hip width apart, and I want your toes facing essentially forward. They can be turned out slightly. All right. Notice where you tend to keep your weight. Is it more towards the toes or more towards the heels? And what I want you to do is bring the weight to the middle of your feet. Equal weight between big toe, little toe, heel. Pedal the knees so that your knees are not hyperextended. If they were hyperextended, go back to that and feel how that tips the pelvis forward, and then soften them so your pelvis can be vertical. All right. Now, put your hands on your ribs if you can reach, if you can do this. If you could do this, you should be able to do this. If you couldn't, then just, you can sort of feel that you can move your rib cage without having to like shift your pelvis forward and back. So rib cage could be up, rib cage could be down. Where does your rib cage prefer to be? Or where does it live? Is it living kind of up here like you're a performer and you're throwing your chest up high? Or is it here where you're kind of slouched down? The goal is to be right in the middle so that the pelvis is vertical and not tipped forward or back, and that the rib cage is not tipped forward or back, but it's somewhere in the middle. So you should feel like you're slightly leaning forward because the weight's in the middle of the feet, not in the heels. Knees are soft, pelvis vertical, ribs vertical. Head and neck, you just kind of nod yes and find a comfortable middle position. And then with your shoulder blades, I want you to start with your hands facing behind you, shrug up, rotate your shoulders palms forward without lifting your chest. I want that chest to stay vertical, and then lower down. So with shoulder blade posture, again, verticality, I'll say that for the third time, most important that that shoulder blade is vertical. We call this position I mentioned earlier, pivot prone, when the baby's on their stomach, like coming into this open Y position. We call this opening and with the arms straight, we call this terminal pivot prone because it gets those shoulder blades in the same position, which is down and back as the pivot prone developmental position, okay? So I want you to think with the shoulder blade position, it's all about, and you could also, instead of doing what I'm doing here, you could start like with your arms together here and open. And what I encourage people to do is like touch your thumbs to your shoulders and try to keep that forearm as vertical as possible. You see, I'm a little from vertical. The more vertical I can be, the better, because that indicates a lack of forward tipping of my shoulder blade. See how the shoulder blade tips forward. All right, so kind of a lot of detail really quickly, but vertical shoulder blade position is dependent upon vertical rib cage position. If my rib cage is not vertical, my shoulder blade can't be vertical. Does that make sense? It's like putting a quarter in a gumball machine. The quarter is only going to get flush with the angle of the machine. And that's how I want you to think about that shoulder blade sitting on your rib cage. So sleep positioning, this is something else here as we get to the end that I'll go through, as well as some of the exercises, just to show a few tips. So we'll come back to this. And then not talking in detail about sport-specific tasks in this class. I hope to do an in-person workshop for overhead athletes here in the next couple of months on a Saturday. If you're local and live local and are interested, shoot us an email, and we'll keep you updated on the information for that. These are the key takeaways. Move through all movements every day, particularly with the shoulder and the hip. These are ball and socket joints with a tremendous amount of range of motion. The more motion they have, the healthier your spine's going to be. And the body is cement waiting to harden. So if you don't go through those movements frequently, when you try to, for some reason, maybe you're trying to like catch something that's fallen and you move really quick, you're reaching back behind you and that shoulder hasn't done that in 6 years, you more likely to hurt yourself if you don't move through those patterns consistently. So when the movement's pain-free, or like I said, like minimal pain and not sharp, train so that you can manage your own body weight and then load the movements in a variety of ways. And you got to master the task at hand, whether it's sport specific or picking up a baby. You got to understand the components of that task, and you got to understand the best way to do it based on posture and body mechanics. Not getting into as much of that in detail here, but that's what we're here for. And we got some good blogs and resources on our website, ipa.physio, and also on our YouTube channel. And there you go. If there's pain, we can help. So there it is. Don't pick the scab. You can't get better if you keep getting worse. I said that earlier. I want to give credit to Nick Hagan, one of our colleagues and buddies up in Oregon. And here is a, you might take a screenshot of this real quick if you're interested. He's got a great ebook out there that's like a deep dive. But the cool thing is, at the start of it, he's like, here's how to use this ebook. If you just want to get like some basic information, start here. If you want a lot of information, go through the whole thing. Nick's a great guy, and I used his ebook as a bit of a resource as I put this together. So that's what I have as far as the presentation. What I'd like to do now in our last couple of minutes is demonstrate like sleeping, offloading the shoulder, sleeping positioning, and then just go through a couple of quick exercises for those that want to hang around. Take about 5 to 10 minutes. But before I get there, I'll give about a minute here if there's any questions before I go off on that final thing. You guys doing good? Everyone in the live out there? All right, cool. So that's the end of the slideshow. But for those that want to stick around for 5 minutes, I encourage you to do so. I'm going to demonstrate a few things over here on the mat. And the first thing is sleep positioning. So how am I on there? Is that good?
Yeah.
So the first thing, if you're lying on your side, you got to make sure that your head and neck is supported well. If you see here, like my neck on this pillow, not supported well. Falls down too much. Pillow's not thick enough for me. As soon as my head falls down like that, I actually feel more stress on my shoulder because my neck and head is not offloaded. So if you have head and neck pain or you have shoulder pain, make sure that you're using a pillow that's a little thicker for that head and neck, particularly when you're on your side. When you're on your side, that's when shoulder issues can be the worst. So I'm going to be here with a thicker pillow under my head. All right. Let's assume that my left shoulder has been painful and I'm avoiding lying on that side. Now the other thing, I would put a pillow between my knees, but I'm not going to use so many pillows right now. And you guys might think this is crazy. There's a lot of pillows anyway, but you're right. Now, even if I'm not lying on that left shoulder, it might hurt if I'm like this all night. So what I'll encourage people to do is use a body pillow or something that could go down between your knees, and do your best to like stack your pillows so that you can be in a position where that arm is completely offloaded. And if you can offload all the way up to that armpit and let that arm be nice and rested, that just feels wonderful. All right, so I've offloaded the top shoulder when the top shoulder's hurting. And I've used enough support under my head and neck so that my neck is not falling down and under supported. Now, if say it was my right shoulder that hurts and I'm just adamant about sleeping on my right side, one thing you could try, and then you just need a little bit more support under your head when you do this, is create a little trough between your head pillow and a pillow that's in line with your body so that your shoulder fits right into that trough. And then again, you got to fluff up or add some support under that head pillow. And now you've offloaded the weight of your shoulder because you've created a little break in the pillows here. And I'd say 10% of people that I show this to actually like it and run with it. The important thing to think about is you may want to support the whole body so as not to create strain on your low back, because if this lower pillow is not here, my pelvis kind of falls off of this pillow. Does that make sense? So support the top arm, support the head really well. If you're adamant about sleeping on a painful shoulder, try offloading it. Doesn't even have to be this thick of a pillow. It could be a bath towel folded over a couple of times and see if that makes a difference. All right. Now let's go through a few exercises. And if you have a pillow, I'll encourage you to have a pillow under your stomach. If you don't worry about it. As long as there's no pain in the spine while you're doing this. So I mentioned before that like developmentally, a baby will kind of lift its arms and lift its back and start turning its head and looking around. So what I want to go through with you right now is a W exercise, and then we're going to do, if you can do the trunk stability push-up, we'll do a few push-ups. And then we're going to do a little bit of crawling, a little bit of rolling, just so you see sort of the functional integration of the arm and the shoulders. So I want your forehead to start on the mat, keep your chin tucked, and just lift that neck a little bit. I don't want you to overarch from your back. So the back should feel like it's slightly elevated, but it doesn't elevate any further as you move. Start with the forearms parallel next to you, hands about shoulder height or a little higher, and then lift those forearms to drive the shoulder blades together. Try to keep your forearms parallel with the ground, because if the hands go down, you're tipping forward. When the hands are back, your shoulders in external rotation and those shoulder blades are vertical or close to posteriorly tipped. And you can hold this position. I'd like you to be able to hold this position for a minute, but we'll just hold to there. Now, what I want you to do is note if you feel your upper trap. And if you feel like you're shrugging up, everyone do this. Shrug up and then de-shrug. And I want you in a de-shrugged position as you do this. Don't start letting those shoulders creep up towards your ears. Stay down and back. Try to keep that lower back relatively relaxed so that the main muscles working are between the shoulder blades. Now lower the forearms and pick them up. Lower down, pick them up. Move slow and be able to stop the movement at any point if necessary. Down and up, and you could continue this as desired. Now, press the hands down next to you, dig your toes in, see if you can press up without any sag in your back. And if you could do that, and what I want you to pay attention to, because I just did it, I had my head like down, and when I pressed up, I had my head like not participating. So go back down, I'm talking to myself here, keep that head and neck in a good position, and press up, maintaining that head and neck in a good position, not letting it fall forward. Now let's do 10 push-ups. 1, 2, 3, 4, 5. If you couldn't do the trunk stability push-up, you can drop to your knees and try it and do the rest of those push-ups from your knees. Okay? Now we talked about developing rhomboid strength and shoulder strength and developing pressing strength. And at the same time, we talked about like babies being on their back and developing their core because they're like flailing here. So one way that we integrate the arms with the core, and you can do it starting without weight and then you can add resistance, is rolling. So what I'd like you to try, or you can just observe what I'm doing, you're going to start with one arm reaching overhead while you're lying on your back. You're going to lift your head and neck as that arm comes towards the opposite pocket. Now at the same time, that same side knee is going to come up towards the opposite shoulder. And you're going to cross over and do what we call a flexion rolling pattern, which means you're activating the whole front side of the body, you're flexing your neck, and you're moving into this pattern repeatedly. Arm starts overhead, head lifts, arm comes down, knee comes up. And I'll use this oftentimes as a warm-up. And again, you can load it, but it's great for training upper and lower body coordination. And if you go through and do about 20, 25 of these, you will also start feeling it as a core exercise. So we've got rolling, we've got the core developing, we did some shoulder blade stability, we pressed. The last thing would be going through a crawling pattern. And if you're in a place where you can crawl, or you can do this later, crawling is just reciprocal upper and lower body movement. This is nothing, but some people got to start here, right? And get that movement pattern. Now, if you pause, make sure that your spine is in a comfortable position, head and neck too. Not too rounded, not too arched. Push your feet down, lift your knees. A lot more of a core demand here. And then crawl in that position, keeping the knees off the ground. And then crawl backwards and feel how that's a lot more of an upper body challenge. Okay? And then go to a push-up position and work on a crawl where you're coming up through a much longer lever. Do like a lizard or alligator crawl, or whatever you might want to call it. But lots of different patterns that you can work on there. And it can be fun and it can be functional and developmental to a degree. And these are just basics, and this is a lot of where I'd start. And again, you can regress and progress from there, and then add load to these patterns as you're able to. So just to give an idea, and hopefully as we've gone through the mobility screen, the neuromuscular control, and just some of the concepts, you can work through some things on your own. And I'm here to, you can reach me up with my email in the box. I'm happy to answer any questions, both now or later. So I'll hang around for another minute. Let me know if you have a question, and if you don't, thank you for being here. It's been a pleasure, and I hope you have a great evening.